things to talk about, and then we'll have Alex Burke, my colleague, give her presentation on transitional, for like transitional care for folks who, we are helping. Okay, so one of the things that I wanted to say is, like, I am so sorry. There was a confusion between, there was a miscommunication between the state and us. And so I sent an email about this yesterday, but just to like clarify again, if the state sent an email to program coordinators at CAC agencies, in our case, New York State Health Foundation grantees, okay? If you're a dual-funded agency, in other words, if you belong to the CSS Navigator Network, but also get funding through the New York State Health Foundation, so, you belong to both of the networks, you should respond to the survey in regards to your CACs only, okay? I have completed the survey on behalf of the entire CSS Navigator Network, okay? And so we only want agencies that have both CACs and navigators to respond one time, right? Okay. The second thing that I wanted to talk about is that the state, so I took a day off, and I got back, half a day off, and I got back, and the first thing I hear is that the state has received complaints by marketplace reps reporting that navigators are hanging up the phone if they're unable to get the representatives they want. Look, let's be serious. We all do this. We're all guilty. We have the largest network. The state said that they know who it is because they have, ID, caller ID, etc. Representatives are aware of who are doing this, and they're reporting you to the state. And also keep in mind that they, it's sort of like a call center, right? And so they sit next to each other, and they can talk to each other, and they know when this is happening. And so please, let's try not to do that. I mean, I know that there are some representatives that are not up to date with some of the updates, but one of the things that I do is that I actually, I have a good example of this, I feel. I'm not going to name the agency, but one agency upstate was told by a representative that the I-94 was not sufficient proof of immigration, and obviously that is not right. And so we got the name of the representative, and we reported this, and they received more additional training to make sure that they are aware of what is and is not considered proof of identification for someone who's like, let's say, an immigrant, a refugee, etc. And so I just wanted to remind folks to remember to be courteous with the call center's representatives and their supervisors. They're doing their best to help us process clients' applications, okay? And I'm sure I'll have comments and questions about this, but we'll wait till the end. Another thing is that the state is aware of parents paying a subsidized CHIP premium, receiving letters from Fidelis saying that now they owe a full premium amount. And so it's, no one raised this during the case rounds, but if you have clients that are, seeing these letters and are calling you, please report them to us, okay? And then these are some administrative reminders. The CNN quarterly report is due, okay? And that's very important. So please remember to email it to me, and you can CC Navigator invoices. So then let me explain what happens, right? If you're sending it only to Navigator invoices, it goes to our finance department, right? And you know, there's too many agencies, we have too many programs, and it can be lost, okay? And so if I don't okay payment, then there will be a delay in how fast you can get paid. And so that's why it's sometimes I ask you for it, and the reason I ask is because I don't have it, and I want to make sure that agencies get paid as fast as possible, right? That their invoices are processed quickly. So remember to send it to me. You can CC Navigator invoices, but for quarterly reports, they should come to me, and that is explained in the email that I sent. The August site schedule is also due a little bit earlier because some of the administrative help here and myself, we're going on vacation, is for me to get all that together, ready for the state. We need to have it in here a little bit earlier. And the CNN and New York State Health Foundation data entry is due, okay? So usually during the year, we have a month in which we skip the CNN monthly meeting, and the month is going to be August. So next month there will be no CNN meeting. However, as you guys all know, since I've been reminding you like every other day, the summer training or the recertification training series starts tomorrow. And so I expect that you guys will like be busy anyways going through that. Again, if you have questions, you can, of course, email me, and I'll send my weekly alerts as usual, okay? I will be on vacation from the 20th to August 3rd. We are pretty, like, skinny here at CSS. Like, there's not a lot of support. And so during that time, my backup will be Leon, who's now on vacation. But I just want to please urge you, like, to sort of, like, try to measure the urgency of the things that you need, right? And so, of course, anything that you email to Leon, CC me. And if it can wait until I get back, that would be amazing. And I would actually really, really appreciate it. I don't want Leon to also be overwhelmed, okay? Again, so July 20th to August 3rd, email Leon McIntosh and CC me for your any needs that you have, okay? I will see there are some quick questions, and then we'll start with Alex's presentation, so give us a minute. Okay. So Star made a comment with like a million exclamation marks. Yes, I know they're also hanging up on us, but that's why we need to know, like, when we call them, like, who are we speaking with, so like we can also give that feedback back, because I feel like if they feel so comfortable complaining about us, then we should also have the information necessary to say, look, this person was rude, or this person gave me wrong information, and this person is not helpful. And that is why when I'm with a client, I feel inclined not to want to speak with this representative, because it, just makes my life harder. So trust me, I know.
They're just saying like they're scared.
Okay, well, we're laughing at the comments, yeah. Look, I know, and that's what I said. That was my reaction when I got back. I'm like, are you kidding me? But again, we have like, I'm sure when the list comes, it's gonna be a bunch of us, because like, including myself, like I'm guilty sometimes. I'm like, I cannot do this right now. I'll call back later. But like when you call right away and they're sitting right next to each other, I mean, I had someone call Actually, I wish Leon was here because it happened to him. He called me. He's like, I called again, and I got the same person. So they really were like, are you kidding me? You hung up and called me. And so it happens to all of us, right? Like, we're trying to help our clients, and so it's challenging when we have someone who's not as helpful. Okay, so I hear you, and I'll give that feedback back. All right, so Alex will start her presentation.
Hi everyone, this is Alex Burke. I gave a presentation probably like 9 months ago now about pregnancy and transitional care, so some of you might recognize my voice if I'm lucky. But today I'm really talking about helping clients access providers, and what I mean by that is kind of tips and tricks on the front end to make sure that providers are in the network that our clients are choosing, and also just some rights that you should know that people have if their providers are not in the network. So, trying to move forward. Okay, so I'm here at CSS on an Equal Justice Works Fellowship. I am a lawyer, though not yet admitted to the bar, so I'm not giving you legal advice right now. But I am funded by Kay Scholler and Pfizer to help clients who have chronic illnesses maintain their continuity of care when they have to transition between MAGI Medicaid, QHPs, non-MAGI Medicaid, and Medicare. So when I think about when you have problems with clients transitioning, feel free to reach out to me directly. I'm a resource for you. And I'm also always interested to hear cases because what I try and do is advocate for clients individually. I also am a navigator, but I also advocate in the policy sphere as well. So Flora and I work together on this, and we're just trying to raise all the issues that all of our clients have in all the ways possible. So, for example, just some cases to give you a sense of what I'm talking about. I had some clients who were over income for Medicare and Medicaid, but eligible for Medicaid waiver services because they had severe disabilities. So I helped them to complete their waiver application. I prevented them from losing coverage, which was like a 6-month battle. I had other clients who did not receive the transitional months that they're required to get when they transition from MAGI Medicaid to Medicare, which I'm going to talk about briefly. So I advocated with the state to get that coverage, which meant that a client who was having surgery and was really afraid about the 20% that wouldn't be covered from Medicare was covered under Medicaid. So that was pretty great. Also have a client who is facing thousands of dollars in bills because of marketplace disenrollment and plan miscommunication. Back in the early days of the marketplace that I think we've all experienced, we've heard about them today in case review, disenrollment and miscommunications. So I'm helping that client understand what went wrong and getting their bills paid. Also bringing up all these issues to the marketplace in various ways so that they don't affect other clients. So today I'm just going to give a brief update on the MAGI Medicaid to Medicare transitions. I didn't hear anything about this in case review today, but I know that people have been experiencing these issues. So I'm just going to give a brief update about what should happen and what we can do. And again, always happy to be a resource for you. I've actually had some clients from navigators in different parts of the state who I am working with now, so I'm very happy to do that or just advise you. Also, I wanted to provide you with some tools to help clients who are switching between insurance and need help accessing their doctors. So I'm going to do some enrollment tips and tricks to choose the right plan, and these might be things that you already do, and I would also be very interested to hear if there's things that you do that I don't touch on. So that's kind of upfront when you're navigating someone. And then I just want to give you a brief overview of network adequacy rights for all consumers so that we can be tracking these issues better, and also transitional care rights that clients have when they switch plans, they might be able to keep their doctor for a period of time, even if that doctor is not in network. And all these things, the later parts of the presentation, are really just so that you can spot the issues and help refer clients to CHA, to me, to Floor, not that you have to be doing this additional work. So, Magi to Medicare transition. This is a big issue. What should happen? So, when a client becomes Medicare eligible during their 12-month Magi enrollment, either because they turn 65 or if they've received 24 months of Social Security disability, this is what should be happening to them. They should not be disenrolled from Medicaid entirely. They will maintain their 12-month continuous coverage. They will be disenrolled from their managed care plan and enrolled in straight Medicaid or Medicaid fee-for-service. They should receive reimbursement for their Part B premiums. That's the $104.90 that it costs to be enrolled in Medicare Part B. This clients will notice that that starts getting taken out of their Social Security checks for some of them. The reimbursement takes at least 1 month to kick in, so clients will have to pay first and then receive a reimbursement check from like computer corporation systems. It sounds very like a room somewhere, but they're contracted with the marketplace to do that. When a client who was in Magi Medicaid is recertified, so at the end or close to the end of their 12-month period, they are supposed to receive their month of certification plus 3 months if they're outside of New York City or 4 months in New York City of extended fee-for-service coverage. And that is supposed to act as a chance for them to apply at the local district for the other programs they might be eligible for, Medicare savings programs, Medicaid for disabled, aged, and blind, Medicaid buy-in program. So those are all the things that are supposed to happen. So if a client comes to you and has any of these things have not happened, we need to know about it. Sometimes it works for them. Maybe they don't want to be a fee-for-service. They're fine. So you can use problems in the system to a client's advantage or not. But these are the things that this is what you should know. So what can you do? Because we've seen problems with every part of this actually happening. So navigators should call the marketplace to request that Part B premiums be reimbursed. Now, I have done this, and I've had problems with it. So that's something to keep in mind. But just so you know, the marketplace has been doing these kind of updates, these official sweeps of their system, but they're not catching everybody. So if you have a client who's aged into Medicare, become Medicare eligible, feel free to call the marketplace and say, my client's Medicare eligible, he has Magi, or she, and we need to get these Part B premiums reimbursed. You can also make a life change in a client's application to show that they're getting Medicare. That can be uploading the Medicare card, just like we've heard with changes, all changes that we make for clients, like address changes. I've seen problems with this. Hurting clients or having them get dropped. So something to keep in mind there. Also, we want to help clients understand the transition from Medicaid managed care to fee-for-service. So that might be something that is not in your wheelhouse, so you don't need to be that detailed. But basically, when clients are disenrolled from Medicaid managed care, I've seen them receive disenrollment notices that do not specify that they're getting fee-for-service. So a client might come to you and be like, what is happening? Well, what's happening is that they need to make sure their doctors accept fee-for-service. They need to be enrolled in Medicare. So that's important too. Some clients are not automatically enrolled. They need to choose to enroll in Part B. And they need to know that their Medicare is now primary. So they want to be looking for doctors who accept Medicare, and then Medicaid will pick up the rest if the doctors are also in Medicaid. So as I'm saying this, I feel like it's a one-pager begging to be written. So maybe I will work on that to share with you guys. But that's kind of the basics of what clients need to know. Please report any problems to Floor, clients, or and me, to both of us. So feel free. My email address is in this presentation. Just Floor and I work together a lot, so don't be afraid that you're going to send it to the wrong person. You can always err us to sending it to both of us would be great. But basically, if clients are not being reimbursed for their Part B premiums, if they're being dropped from MAGI without any notice, if they need extensions to apply to the local district, if they need help applying in the local district, these are all things that we can help with and also want to be tracking. Okay, Laura's gonna.
Yeah, so I just wanted to say, so what our strategy so far, we have what is supposed to happen, but what we're trying to do is also show the different outcomes that are happening, and to figure out what is the best scenario for our clients, and in order for us to be able to do that and say, hey, I have 5 cases with 5 different outcomes, which one is the correct one? We need to be able to track this, and so we're still reporting it to the state. But then the reason we want to add Alex is because with her project, she's able to also identify these specific trends that we're seeing, or the different outcomes, and then write, for example, that one pager as to what as navigators we should do to or when we have a client that we're anticipating to be in this situation, what's the best course of action. And so I think that is why it's a big issue. It's a big issue, and I think the state did mention in a call a couple of weeks ago that they understand, they realize, and hopefully the training tomorrow will address part of this.
Right, and I'm looking forward very much, probably more than maybe anybody in the state, to tomorrow's training about what they think is supposed to happen. But as you can see, there's a lot of things that go on when someone goes onto Medicare, and if every part of that is wrong or causing problems for clients, it's hard, and that's why it's really our job just to send the AC number and some information, or just call. Okay, so I'm going to switch gears a little, going back to choosing the right plan. I guess maybe should I see if there's any questions right now? I'm going to.
Can you guys hear us better?
Sorry, we're seeing now that you're I sound like I'm underwater. Okay.
Can anyone write in the question section whether you're hearing us better, please?
Or write if you're hearing us worse.
There are more people.
Okay, I'm scrolling. Better. Okay.
Great. Thank you.
Sorry about that. Okay, I'm glad I'm not underwater anymore. Somebody also asked, Sylvia asked, what if the client did not pay the Medicare Part B premiums? So that's a good question. So there's 2 things that might happen. Okay, so it's possible that a client didn't enroll in Part B and then are not paying the premium because of that. That's going to be a challenge because you want to make sure that clients enroll, or you want to help make sure that they enroll within their period of enrollment, which is 7 months long. They're 2 months before their birthday month, and 2 months after, but that's not 7 months.
Let's make sure. We should not advise clients to drop their Part B premium. Their Part B.
No, we want to be, if clients have a question about Part B, we want to be encouraging them to take it.
Yeah.
So that's why I'm just saying if somebody doesn't pay their premiums, it might mean that they didn't have premiums. Or it might mean that they didn't pay their premiums, which I have a client who this happened to, who I got from one of the navigators in our network. Basically, this client had received notice from the Social Security Administration saying New York's going to pay your premiums, and then New York didn't, and now we're trying to figure it out. So that client did ultimately, he paid his premiums on a credit card. Hopefully he will be reimbursed soon, because I think there is a chance that you would be dropped and that will cause problems. I don't know the details of that, but we want to be advising people to pay. But the marketplace, this one client, I am in the midst of kind of a slightly epic battle to get him his reimbursement. So it's ongoing, but I'm happy to update people who are interested. Okay, so someone else is asking, I don't know why I sound underwater. Someone else is asking, when you say the marketplace will reimburse, will reimburse the consumer for Part B, does this mean that they will apply for the MSP for the consumer? Have you had successes with this? Okay, so MSP is Medicare Savings Program, and for those who don't know, a Medicare Savings Program is kind of like a Medicaid option, and there's different tiers of Medicare Savings Programs that you can get into. So some people who might not be eligible for Medicaid would be eligible for this Medicare Savings Program. The state has said that they are reimbursing for Part B premiums, not applying for Medicare Savings Programs. So while a client is in their 12-month continuous coverage period, they cannot apply for Medicare Savings Program. Now, this is like, if you want to get really in the weeds, some clients might prefer a Medicare Savings Program. So like I mentioned, if they miss their Part B enrollment period, they can enroll in a Medicare Savings Program, and that will get them into Part B without any penalties. But that's going to be the minority of clients, and I'm learning this issue along with everybody. And so if you have a client who you feel like they really need an MSP, not just because they managed to learn about an MSP and are very well informed and want it, it's helpful. You should totally email me or call me and ask, because sometimes it's not actually necessary for them to get an MSP. Also, if it is really necessary, there is a process, but it takes many months, and it involves getting the client into the local district and reapplying. So I'm happy to talk through these specific issues with you.
Okay, can I make a comment?
Yeah.
So one comment that in the way I'd like to see, look at this is the reason, so folks that are in 12-month continuous coverage, they're benefiting from MAGI budgeting, is that correct, right? So higher level of Medicaid income, right? Once they're transitioned to the local Department of Social Services, their Medicaid, they become non-MAGI, right? And so the income threshold is significantly lower, right? And so to answer your question, Arlene, I would like have them have their premium Part B reimbursed while in their 12-month continuous, because at some point it will be reassessed for non-MAGI budgeting, right? Like, so for the don't quote me, 809 or something like that?
It's
for a household of one?
Yeah.
Versus 1,200 around for, okay, yeah. 1342, great. And so what I'm saying is, like, have the client benefit from getting their Part B reimbursed, because chances are that they won't get a QMB, right? When they're in the,
yeah. Well, they will get, so, yeah, right. Think of it as the Medicare Savings Program is really, might be something that's good for them after their transition to the local district during that transitional period of 3 months if outside of New York and 4 months inside of New York City. That's when they should be applying for Medicare Savings Program. Okay. Sorry about someone mentioned, will this information be available after the call? I think the PowerPoint is available. Also, after the inning tomorrow from the state, maybe I'll do an update, and my contact's always available. Another question is, I just want to make sure I'm not missing. Okay, so Sylvia says, no, we said this. Okay, so can an individual who's 65 plus get QHP or private coverage on the marketplace if he or she does not have enough working quarters to get Medicare coverage? I believe that the answer is yes. If you are ineligible for Medicare, you can get a qualified health plan, but you can also sometimes buy into Medicare. So let me double check the details on the 65 plus issue. But yeah, if you are Medicare eligible, definitely not. Another question is, at the end of the 12 months of continuous Medicaid coverage, is the marketplace sending the client's info to LDSS so they can be considered for MSP? So that's a great question. I don't honestly know the answer to that. And the reason I don't know the answer is that I haven't seen it happen. What I understand is supposed to happen is that the client is supposed to receive an application from LDSS and notice that they're being sent to LDSS. I'm not seeing what that looks like, so I don't know if they get like a partially filled out application or what the LDSS sees from them. This is something that I'm advocating about with the state right now to understand that process better and to make it work. So if you have a client who this happens, who's in that period, I don't think there's any reason for them not to fill out an Access New York application and take it to the local district themselves, or a Medicare Savings Program application, because I don't know that the transition is happening any more than them receiving a research packet from the state. Right, and the follow-up to that question is, if they're not Medicaid eligible, are they being considered for MSP? They should be, but they have to actually apply. And yeah, maybe a sending as well. Okay, so another question. You guys are asking great questions. I have a couple whose ages are 72 and 74. They're not receiving Medicare or any sort of SSA income. They were told they need to enroll in the marketplace. They're surviving by using their savings. It's not because they're over 65 years old and need to do a paper application for Medicaid, but they're over-resources. Any recommendations? Yes. So when I read that, my questions are, why are they not eligible for Medicare or any SSA income? Is it because they're not, is it an immigration status issue or a work quarters issue? Are they 2 years in the USA, they're LPR? Okay. So there's a variety of non-Magi Medicaid programs. There's just straight non-Magi Medicaid, which is, like Fleur said, the lower income amount, and as Giselle is referencing her question, also there's a resource test, so they might be over-resources. So they're over-resourced for that. They might be eligible for a Sundown, I think, has higher resources. No, same resources. Maybe the Sundown won't work for them. There's also.
So, okay, so it seems that they're living up their savings. So if they're income eligible for Medicaid, then the only issue is the resource test. I encourage them to call. Oh, you guys have a Chagan Giselle. Hi, this is not Israel. I would encourage you to call, because there's some things that can be done to help them with the fact that their resources are over, like a trust, good, Eden. And so, but if they're not income eligible for Medicaid, right, through like non-Medicaid, they should go into the marketplace and apply, and they can get tax credit. But it seems that that's not the issue. We can also look into the Medicare buy-in.
Yeah, there's a Medicare buy-in, which I don't know very much about. There's also if they're disabled, they're over 65, so they can't access the Medicaid buy-in program for working people with disabilities. So those are some options for them. So it's really about knowing more about what they need care for and if they're really going to need.
Yeah, I think, we can talk about that offline to troubleshoot different ways that we can get them into the Medicare program. That's the problem. Once you're over 65, there is a resource test. And so like if you have above a certain amount of money in the bank, or, they count that against you. Okay, so
Okay, we have one other question, which is an MSP similar to a health savings account? I think the answer is no. I'm not honestly super up to date on health savings accounts. My understanding of them is that they're like money in an account that you can use to pay for healthcare. A Medicare savings program is really different because, well, there's the different kinds of Medicare savings programs, but it really affects if you're eligible to sign up to Medicare with a special enrollment period, and also how doctors can be paid the 20% that Medicare doesn't cover if they're enrolled in Medicaid. So that's kind of a lot of information, and Medicare savings programs are not something that you really need to know about.
Yeah. And so basically we want to provide you with the tools to sort of like have an understanding when clients come to you, but in general, like we understand for those of you who are not, community health advocates, feel free to refer those clients to our helpline. It's a lot of information, and I am so sorry.
Okay. Well, Jonathan came in to help us make it sound better, but it looks like it should sound fine. Is it fine now? Can people type in again to let us know? Underwater.
Okay, guys, give us a couple minutes. Let me try to see what's going on here. Okay, Jonathan is here.
Okay, we're back. We don't really have any solutions, but I'm just going to try to sound above ground, and if you have questions, you can type in again. Okay, so switching gears to choosing the right plan for clients who come in for enrollment purposes. And again, thank you for all of your questions, and I'm happy to answer more at any time. Okay, so okay, so providers and plans. So this might already be happening, but when a client comes in to do an enrollment through with you guys, you want to ask them to make a list of the doctors that they want to continue seeing to check what plan networks they participate in. But it's really important to remember these things. One is that just because a facility is listed as in-network does not mean that all providers in that facility are in-network. Many times I have clients come and tell me, oh great, well like Lenox Hill is in-network and my doctor is at Lenox Hill, so we're good. No, we're not good. We definitely want to check if the doctor is actually accepting the insurance at that hospital or anywhere. You also want to check the location where the doctor is listed as in-network. Just because the doctor accepts insurance in one location, that does not mean that that's going to be the location the client usually sees them. And they might accept it in one office and not in another. And that's the kind of thing that's going to cause a real issue and have clients coming back to you asking to switch plans. So to check if a doctor is in network, here is the gold standard. This is what I usually do. I call the doctor's office, and while I'm calling them and I'm on hold, I am looking at their website. So you want to ask them which marketplace or exchange insurance plans do you participate with, or which Medicaid managed care plans do you participate with. And please be as specific as possible. I'm sure that you've all experienced this situation, but every insurance company has multiple plans. So Fidelis was brought up before. Their Fidelis CHIP plan might be accepted somewhere, but their Fidelis Medicaid plan is not accepted, and their Fidelis QHP isn't accepted. So you really need to get down to the nitty-gritty. And just because the doctor says, yeah, we take Fidelis, that does not mean that your client's Fidelis is going to get them in to see that doctor. So we also want to look for the provider on the plan's website. And again, is the office listed? Is it the same office where they want to see the client or where they want to see the provider? And you can always print it out as proof that the provider was listed on their website. Another thing to keep in mind is the plan formulary. So if a client takes prescriptions regularly, you want to make sure that those prescriptions are covered on the formulary. You want to know is it covered at all? If so, what tier is it? And are they subject to the deductible? So here I pulled up just an example of just like through the marketplace. This is Health First Bronze Leaf in New York City. So the big arrow shows the specialty drugs. So this says in-network cost share. So if their drug is a specialty drug, it's going to be a $70 copay. And when it says, is it subject to deductible, it says yes. So that means that until the client meets their deductible, they will not have the benefit of the $70 copay. That drug might cost, it's an amount that's going to be negotiated between the plan and basically the plan will set the rate for that drug. So you don't really know how much it's going to cost until they reach their deductible. And that's important information for somebody to know. I also wanted to use the example, this is a formulary I got here using the New York State of Health, going to the plan document. So I'm on the top right, or the arrow on the right, I'm just pointing towards, it says ST and PA. Here in this formulary, that means there's prior authorization and step therapy. So if you have someone who has ADHD and they've gone, they've taken a long time to get to the drug that they use, and it's this drug, this plan might require that they try another drug first and fail, or it will require, or it requires that you have prior authorization. So if this just means that it might be fine for the client, but it might mean that they have a delay in between getting into the plan and being able to access the drug, and that might cause a real issue for them. So I just want to go back for a second. So that's what I'm talking about when I say plan formulary. So those are just things that I really suggest, especially clients who have chronic illnesses or are expressing concerns to you about, like, is this covered, is that covered? Ask about their pharmaceuticals as well. Okay. So network adequacy rights. What I just talked about was how to make sure you get a client into the plan that's going to be best for them. This is once you're already in a plan, what are your rights? So because most plans require that you stay within network, the network must have enough doctors of different specialties in different locations to meet members' medical needs. And different plans, so HMO, Medicaid managed care plans, and PPOs or EPOs have different requirements for their networks. So there's different, like how far away a doctor can be, and it's governed by different agencies. So big thing to know is just Medicaid managed care. You're supposed to be able to see a primary care provider within 30 minutes if you're in an urban area, or 30 miles for a rural area. And you shouldn't be waiting more than 28 days for a standard appointment or 1 day for an urgent appointment. So what does this mean? It means that if you have helped people enroll and they're calling you back and saying, I want to switch plans because I can't find a doctor, we want to hear that, and we want to ask a couple more questions about it. So again, HMO requirements, if you're a non-Medicaid HMO, and there's not the same like 30 minutes or 30 miles, the network just has to be adequate to meet the comprehensive health needs of its enrollees, and to provide an appropriate choice of providers that are sufficient to provide the services covered under its enrollees' contracts. And the providers also have to be geographically accessible. So again, it means that the questions are a little different if someone comes back to you and says, I can't access a doctor, but they still have network adequacy requirements. And it's the same for PPOs, EPOs, and POS plans. I don't think there's POS plans on the marketplace, but and there's not really PPOs, and there might be an EPO. There's some EPOs, but the same requirements. Different, but these are governed by the Department of Financial Services. So, you enrolled Samantha in health insurance a few months ago, and she calls you today because everything was great with her insurance, but she's been experiencing depression, and she really needs to see a psychologist. She's been trying to find one, but she can't in her network. And she's been calling through the list of providers from the plan's website, but no doctor accepts her insurance. Or if they do, she can't get an appointment for 2 months. So what can we do to help Samantha? Well, sorry, I'm going to go through this. So we can ask the questions, what kind of plan does she have? Because that changes what her rights are. What has she done to find a doctor? She said she's looked through the plans listing online. You might want to call through some offices with her to ensure that she's asking the right questions. We also want you to fill out the network adequacy report form. I know that Flora has sent this out a couple of times to the Navigator network, because the client might be able to receive child services to access providers, or they might be able to try and get a special enrollment period. I see a question, but I'm just going to show you. This is what the network form looks like. It's pretty simple. We don't even need to put the client information in there. We just want to have a sense of what is the issue, because we're trying to track this for the state, because we know that just because a listing is, I should back up. The reason that I care about this issue so much is, like I said about my project, I'm helping people with transitions. Well, a big thing is, you and I are going through the list of providers of clients, and if that list is wrong, then they're going to be making a choice that gets them into a plan that doesn't work for them. So that's a real problem. Okay. So Giselle's asking, if someone wants to enroll in a different Medicaid managed care plan and they're already locked in, is there any exclusion to the rule? For example, a surgery that consumer needs and the doctor who specializes does not accept the HMO. That's a really good question. So if someone wants, if someone wants to switch plans because and they're outside of the rule, I think I should know the exact rule, and I don't. I do know that I've heard that people are actually able to switch through the marketplace online outside of that 90-day rule, and if they I've seen that that's happened, so you might want to just check if they're able to do that. That would be an easy way to solve the problem.
Just to add to Alex, in general, Giselle, if someone comes to you, and I've seen this in my days as a health counselor, is if someone comes to you and they say, look, I need to get this surgery, and the doctor that I want to, go to does not accept this Medicaid managed care, can I switch? Well, they need to like prove that, you know, there's like, they looked at other providers within their Medicaid managed care that is like, and that they looked at those options. They will not just switch them because the doctor that they prefer is not there, unless it's like, you know, that doctor is within a specialty, is like specialized, and we can prove that, you know, that person is the right person to like, you know, get, you know, that surgery done.
And this is really, I would say this is a CHA issue, so
yeah.
navigators should not have to, if you're only a navigator, you shouldn't feel like you need to get involved in this. You want to send them to CHA, but you can call the plan with them and make the plan do some work, right? Because they're required to serve their clients. So you can call the plan and ask to speak to a special, like a provider services person, and just explain the issue, and they might actually help your client find the right person. Oh, and Rick is asking, what is CHA? And I think, welcome to the Navigator.
Welcome. It's Community Health Advocates. We're New York designated consumer assistance program. And so in essence, we every time you get a denial from your health insurance, or just whenever you get an explanation of benefits, if you disagree with it, you get our phone number, because we help folks not only get health insurance through CNN and the New York State Health Foundation network, but also make the most of their health insurance and actually get access to care, right? Like, that's a huge deal, right? Like, it's one thing to have health insurance, but are you getting the actual access to it? And so that's what we do. And we have lawyers on staff. We have social workers, right? Like, so all of us here at one point have been through CHA, and so we help with appeals, complaints. We just advocate for people to get access to care, and it doesn't matter where they got the insurance. So it can be employer-based coverage, it can be union-based, it can be through the marketplace. It doesn't matter. We help you, access it. And so the phone number is the same as the Navigator, the main CSS network number. So it's 1-888-614-5400. And so you can call, and there are different options you can from our different programs, and you can get connected with someone in our helpline to provide you information, or to do an intake for a case. So you can refer cases to us if you need to. Okay.
So I'm keeping an eye on the time, so I'm going to keep going, and I'll stop for questions in a little bit. But I wanted to touch on transitional care rights. So the network adequacy piece is I'm trying to find a doctor and I can't. And transitional care rights are I have a doctor who's amazing and they don't take any of the plans on the marketplace. What am I supposed to do? So certain HMO enrollees, so if somebody enrolls in an HMO through the marketplace, whether it's Medicaid or non-Medicaid, they have a legal right to continue receiving care from their current doctor, even if that doctor is not in their HMO's network for a fixed period of time. So this is really helpful, and I've had this clients who come in and they're like, this is the doctor that I care about, and they're not in any network. This Obamacare is such a mess. Well, actually, you might have some rights. So I'm going to go through who's eligible. One way is that the client is enrolled in an HMO and has a life-threatening or degenerative and disabling disease or condition, and they're receiving an ongoing course of treatment. They're eligible for 60 days of transitional care when they go into the new plan. So, for example, Max has cerebral palsy. He was enrolled in Medicaid until he became over income and had to enroll into a private HMO through the marketplace. While enrolled in Medicaid, he's been seeing Dr. H to be fitted for a wheelchair, but Dr. H does not accept the new private insurance and is not done fitting Max for the wheelchair. Well, transitional care should enable Max to continue seeing Dr. H as though the doctor is in network. And the new insurance will pay the doctor as though he's in network for 60 days. So who else is eligible? If your client is enrolled in an HMO and enters the second trimester of pregnancy by the effective date of enrollment, they're eligible through postpartum care. So Laura makes a navigator appointment with you. She has a special enrollment period to enroll because she quit her job to go freelance and her COBRA just ended. And we know that you don't get a special enrollment period for being pregnant. So she is 16 weeks pregnant and has been seeing a doctor who she loves, and that doctor does not take any plan. You can tell her that she should be able to continue seeing the doctor she loves through her pregnancy if she enrolls in an HMO through the marketplace. And I'll talk about why I'm saying all the shoulds in a minute. The third way that you could be eligible is if the client is enrolled in an HMO, they're engaged in a course of treatment with a doctor, and the provider leaves the plan for reasons other than fraud or disciplinary action. If the client is eligible for 90 days of transitional care, or if they're in their second trimester when the doctor leaves the plan through postpartum care. So, for example, Rachel calls you and she's really upset. You helped to enroll her in a QHP a few months ago, and you haven't heard from her since, but now she wants to change insurance plans because she just went to her OBGYN and was told that that doctor is not taking her insurance anymore. She does not have a special enrollment period unless, of course, she has another one that is not included in this example. And she can't change plans if she doesn't have a special enrollment period. But she can continue to see the doctor she likes. The amount of time she can see depends on what trimester she was in when the doctor left the plan if she's pregnant. So how do you get it? They have to work out the details with their doctor. As a navigator, you should really just inform the client of their right to transitional care and refer them to CHA for further help. The clock is ticking for them, and you do want to know that, as I mentioned, the doctor really has to agree and kind of be on board. The client has a legal right to this, but the doctor doesn't have to contract with the new plan. So it's not a super guarantee, but for those clients, and I'm sure we've all seen them, who are really kind of desperate and really want this, it could be majorly helpful for them. So what we would do on the CHA side is confirm that the provider doesn't accept the client's new plan. Ask the provider if they're willing to bill out of network and explain that they will be paid the plan's in-network rate. So we're just going to keep using Fidelis as an example. The client transitions into Fidelis. Their doctor does not accept Fidelis. If they want to get transitional care, the doctor is basically agreeing to bill Fidelis out of network and be paid the Fidelis rate for an in-network provider. You want to call the HMO and find someone who handles transitional care, because basically you just want to know the plan's process so that the provider knows, okay, who do I call at Fidelis? Like, what's the phone number for me to call them and bill for this client? You would want to follow up with the client and provider to make sure that it's working. And if it's not working, you want to file a complaint. Also, if this client has Fidelis HMO, that's a Medicaid Fidelis, Medicaid HMO, you want to remember that balance billing of Medicaid members is prohibited. So if a provider treats a patient with Medicaid, they can't balance bill them for the amount that they are not being paid. Okay, that was a lot of information, but I hope it's useful. Okay, and we have a question. I thought the state had passed legislation that now made pregnancy a qualifying event. My understanding is that that's on the horizon, but it's not happening yet. But I will double check that for you. Does anybody else have any questions? You can raise your hand. Sorry. I think Rick's question was from before. We're just looking to see if anybody else has their hand raised. It looks like not. And no other questions. So I guess, yeah, my information is here, my email and my phone number. I would really love to hear from you and about any clients you have who are transitioning between MAGI to Medicare, transitioning between MAGI to QHP, MAGI to non-MAGI, or having any issues with providers. And I'm just gonna, I think we're done, but Flor stepped out for a second, and I don't want to say we're done without confirming that with her. So everyone hold tight, and if you have any more questions, please raise your hand. Oh, great. So sorry, there is another question. So, okay, if someone does, okay, so the question is, same question as above, which is, I think, if someone's enrolled in a different Medicaid managed care, and the doctor is not in network, does the client have transitional care rights? So the client, transitional care is for if you are already receiving care. So you can't want to see someone who's not in network who you have not been seeing, and the transitional care won't apply to them. So if your client has been in Fidelis, but this doctor only takes United, and he has not seen that doctor, it doesn't count. Okay, I think, are there any other questions? Done, we can end the call if you're good.
So if you guys do not have any other questions, I'm so sorry I stepped out quickly, and I think we're good to go. Thank you, everyone, for bearing with us. I know we had some technical difficulties. If you have more questions for Alex or for me, please email us. Again, there are a couple of things that I'm going to follow up on that, we're trying to identify in-house and that we're working on. Alex and I will work on the Medicare transition folks, and we're going to report those disenrollment. I have a couple of AC numbers in which folks have been disenrolled, and so I'm going to also report that to my contract manager to see what is going on, what's the glitch here. Okay, thank you, everyone, and have a great rest of the day. All right, and so just remember, I'll be on vacation. Use your best judgment. Try to, if it can wait until I get back, please, I beg you as a favor, do that. But if not, email Leon, CC me, and he'll try to, address your question or concern as soon as possible. And as usual, we will send the presentation in next week's, in this week's weekly alert, okay? Thank you so much, all. Bye-bye.
Bye.